I walked into the doctor's office on the first day and said, I don't want some guy I hardly know to rearrange the plumbing. It was not for me. At the time, there were two choices. You could have the adjustable gastric band or the lap band, or you could have gastric bypass.
So lap band is probably the purest model of what we call restriction. It's a band with a balloon on the inside that wraps around the top of the stomach. You wrap it in a position so that you have about a golf ball sized little pouch. So you swallow a bite of food, it goes down your esophagus, tube from the mouth into the stomach. The band squeezes on the outside wall, so then it stops that bite of food you put in, and the stomach slowly squeezes it through.
So it totally slows you down, and it just gives more time for those signals to be sent to the brain to say, yep, I'm full, stop eating. So you're able to actually eat smaller portions of food and actually be satisfied.
These operations really work differently than that, though, as we know more and more about them. They all work on changing hormones, or the ways your body communicates with your brain, your liver, your pancreas.
The lap band surgery takes about 45 minutes to an hour to perform, and it's done as an outpatient. Usually people are able to go home the same day.
I got cleared for lap band, and I did well. Out of almost 6 years, I probably had 60 pounds off after 4, and then, a few more as time went by, and I've maintained that loss for all 6 years.
It's surgery, but you're not cutting anything, so if you believe that that is going to lose the weight you need to lose and it's going to correct your life the way you want it to correct it, that sounds like a perfect option because it's reversible, it's simple, you're not cutting, risks are lower.
I hear from a lot of people, everybody knows somebody who had weight loss surgery and it didn't work. I had gastric bypass, had lap band, it didn't gain all their weight back, it didn't work. It worked fine. It gives the patient the ability, the tool, to accomplish what has been anywhere between difficult and impossible to accomplish in the past.
People would describe it as a more high maintenance compared to the other two because you are needing to come in for adjustments or tightening of the band as you're losing the weight. This is typically a 2 to 3 year process.
So you go in for periodic adjustments where they add a little fluid, add a little more, and it gets a little smaller. And if they need to, they can go back and take it out.
You have to change how you eat and your lifestyle, meaning you have to chew your food, so we tell them 25 times. You have to essentially puree it like baby food before you swallow it. If you choose not to do that, you're going to be uncomfortable and or throwing up. So it doesn't negotiate with you.
Getting food stuck was probably number one, and all these years later, it really still is.
So if you're trying to lose a significant amount of weight, usually people don't move towards the lap band. I've had patients lose 200 pounds of lap band. It's doable, but usually you're looking at the other options when you're having a significant amount of weight to lose.
They said to me, is the lap band working for you? So what do you expect it to do? It's 28 cents worth of plastic. You have to want it. And this surgery does not hand it to you on a silver platter. It makes it available to you if you want to take it.